Today we're going to look at one of the many imaging tools used in the health field, and that's X-ray. X for X-ray.
When a patient comes into the office, we typically will do a full history and exam to determine what's going on. Sometimes an image is required, and sometimes an image is not required. In our offices, we don't have any X-rays or MRIs or anything like that where we can actually do the images in the office. So if we do require an image, we'll send that patient out to get that image done. So what are some things that we do and ask ourselves in order to determine if we should order an image? If we look at this flow chart here, at the top, one of the first questions we're going to ask is, will this test give me any information that I couldn't have gotten from a physical exam or a history? So if an X-ray is going to give me some information that I didn't have from my physical exam or history, then I would consider getting it. For example, if someone were to have arthritis within a joint or a fracture within a joint and I can't feel that or do a test on that with a physical exam or figure that out through a history, then I may want to get an image. If it's not going to give me any information that's new based on our physical exam or history, then no, I'm not going to get an image. I'm going to do a trial of care. So if we do answer yes to that question, we're going to move on to the next question. Is the information I get from the image going to impact my treatment? So if I see something on the image, is it going to change the way I treat the person versus if I didn't get the image and I didn't see whatever was on the image? If the treatment plan is going to change because of something that's seen on the image, then yes, I'm going to go down that route a little bit more. If the treatment plan is not going to change based on what's seen on the image, then no, I'm not going to get an image. I'm going to do a trial of care. Back to if we could potentially have a change in treatment plan due to what we're seeing on the image, we're going to look at this third question. Will getting the image improve my overall outcomes? So will the patient's outcomes be better if I get an image, or will they not be better, or there will be no change based on giving the image? So if I can answer no to that, again, I'm not going to get the image and I'm going to do a trial of care. If by getting the image, X-ray, MRI, or whatever the image is, will improve my patient's overall outcomes, then yes, I'm going to order the image, so it will help improve the outcomes. So it potentially may change my treatment plan and potentially will give me new information that I wasn't able to obtain on a physical exam or history. So if I answer no to these questions and I do not get an image and I do a trial of care, if I fail or if the patient fails that trial of care, then we will reevaluate, do some reexamination, redo a history, see if there's anything we missed, consider imaging at that time. Also consider other tests, whether that's labs or other orthopedic tests that we didn't do, and other treatment methods that we didn't provide at the time, as well as potentially looking into a second opinion. So even if you fail a trial of care, there's a maybe on if we would get another image to see if it would help improve outcomes. But there are other options, doing other types of tests, doing other types of treatments, getting a second opinion from either a different provider or a different professional within the field that could potentially lead us in the right direction. So those are things that we look at with if we get an image or order an image in the office, if it's appropriate at the time to get an image. We're not just going to order an image just to see what's going on, just to see structures, things like that, because it's not necessarily going to improve the overall outcomes of the patient. Some things to note with imaging are we want to focus more on treating the patient and not the picture. So if we do have an image, whether it's from a previous provider or something that we order, something shows up on that image, we want to make sure that we're not just treating what's on the image. We want to make sure that we're treating the actual patient. So we're taking that image into consideration, but we're also taking a look at our physical exam and how the patient is presenting that day. We should use that image again to improve those patient outcomes. X-rays and images are specifically just screenshots in time, so things change over time. If you had something show up on an image years ago, so for example, if we say we had a a fracture that showed up a couple years ago. Most likely that fracture has healed over time, and if we take an image again, we're not going to see that fracture again. Same thing with a disc bulge. If we have a disc bulge or a disc herniation on an image from a couple years ago, oftentimes if we were to retake an image, that disc bulge or herniation would not be there anymore. So just because you've had something on an image in the past does not mean that you have it now. And that's because a screenshot or an X-ray or an image is a screenshot in time. X-rays in general are not a good screen tool for pathology. We're specifically talking about X-rays. And the reasoning for that is because it's not a sensitive tool. And an example would be you need about 30 to 50% of bone loss, so osteoporosis, osteopenia, that type of bone loss, before you can actually see the bone loss on an X-ray. So it's not a very sensitive tool in that regards. So a negative X-ray could actually mean there is actually some unseen pathology. So if you're not seeing anything on an X-ray, it doesn't mean that there actually isn't something going on there. And you would want to determine that actually through your physical exam and history, because the X-ray is not going to show everything. However, the X-ray that you can get is a very specific tool. So if there is a positive finding on the X-ray, most likely it is actual true positive, and what you're seeing is actually there. So if you see an X-ray on, or see a fracture on an X-ray, most likely there is a fracture. And lastly, the physical exam and history is actually more sensitive to pathologies than X-ray. So you're more likely to figure out something is wrong through a physical exam and a history than you are by doing an X-ray.